Hello, everyone around the world. Welcome to the TBPPM feature stories. We are really pleased today to have with us Ramya Anantakrishnan from the REACH program in Chennai, India. We are looking today at our feature stories where we have an opportunity to listen to the voices from our community members from around the world and to explore what their work that they are doing, especially in engaging the private sector, and hear their stories and experiences and lessons to share with the rest of the community. So today, I'm very pleased to be talking with Ramya. We are talking about the TB-Free Chennai initiative, which is a flagship program spearheaded by the Greater Chennai Corporation and supported by REACH, which is the Resource Group for Education and Advocacy for Community Health. Ramya is leading that initiative, and she is talking today to us about the Nakshatra centers, where they are working together with private hospitals and engaging private providers in TB care. So I'm really happy, Ramya, to maybe ask you as a first question, can you give us a brief overview of the TB-Free Chennai initiative?
Yeah, thank you, Petra. So as you mentioned, TB-Free Chennai is a program which is owned and spearheaded by the Greater Chennai Corporation in Chennai city. It is a city in south of India, and it has a population of about 8.6 million. And REACH has been supporting the private sector engagement under this initiative by adopting a multi-pronged approach with a specific focus on the urban slum population. And the key highlight of the private sector engagement under the TB-Free Chennai initiative is that the entire spectrum of private healthcare providers along the cascade, which means right from a private practitioner, a chest physician, it could be a general or a specialty practitioner, a private pharmacy, private laboratory, and a hospital. All of them are brought together through this initiative for achieving this TB-Free initiative in the city.
That's great. And can you tell us a little bit about the project and maybe specifically focus a little bit on some of the challenges while you're implementing the project?
Yeah, so the key highlights of the project, as I mentioned, is engaging with the different types of private health sector player. Another key highlight of the project is setting up of centers called the Nakshatra centers, which are basically exclusive spaces in the private hospitals provided by the private hospitals to us, where we place a community health worker called the TB Nanban. So Nanban means friends. And so that this Nakshatra Center actually functions as a one-stop shop for all the TB care services. And the second key thing here is that we have been promoting private linkages so that the private sector players in a particular area are able to refer and cross-refer between themselves so that a person with TB ultimately gets access to quality care and diagnosis. So that is the key highlight of the project. And also when we look at private sector engagement, because we have a health worker positioned in the Nakshatra Center, we actually travel with the person with TB in his or her entire journey, right from when they come in with symptoms of TB to finally getting diagnosed, initiated on treatment, and successfully completing treatment. So this basically helps us to minimize the drops along the cascade, and also it enables things like good rapport with the person with TB, good rapport with their family members, so that we could actually provide holistic care and support along the entire pathway. When we actually started implementing this project, I think the key challenges was getting the buy-in from the private practitioners, because this is a non-incentive model. And the question was, why no, should we provide space? Because as you know, it's a commercial space and it is money, right? And they provided this free of cost. And also initially there was a little bit of resistance to actually receive referrals from the private practitioners around the hospitals, because they wanted to exclusively focus on the referrals coming from within the hospitals. But that said, as we started rolling out the program, and when they actually saw how the program went, because we do find and see that many practitioners would like to send their patients to one particular hospital which serves as a one-stop shop. So they get their x-ray, they get their sputum tested, they get their medicines, but they come back to the private practitioner for all their consultations, right? So, so that was something which individual private practitioner was very comfortable with. So this whole mechanism, as they started implementing, as they started engaging with us, and when they actually got the feedback from the people who actually completed treatment, I think that was when there was quite a conviction that this could work. To the tune that at the end of 2 to 3 years of implementing this initiative, each of the Nakshatra Center hospital had referrals to the tune of about 1/3 coming in from the hospitals, and nearly 2/3 coming from the private practitioners and laboratories and pharmacists from around the hospital. So I think that was one of the key challenges. And I think as we today we have about 40 Nakshatra centers, and because of the branding created around the term, Nakshatra means star. So we did create this branding. So this actually helped in a way that as the program scaled up, hospitals started coming forward and expressed interest to be part of this initiative.
That's excellent. That is really, really great to hear. And you said 40 centers, right?
Yes.
Yes. And so does that cover almost the whole of Chennai, or?
Yeah. So we had positioned these centers so that the whole of the city is covered by these 40 centers.
That's fantastic. So that and are you planning to continue within all these 40 centers, or are you planning to expand?
So I feel we have found the balance, because initially we wanted to see whether we should set up one Nakshatra center per 100,000 population, which is the same number that is available in a public sector.
Yeah.
But as part of our initial scale up, we scaled it to 40, which is roughly half of what we had imagined initially. And today we feel it's a good number to cater to all the private sector patients. And I mean, depending on the need, depending on the number of people who go to the hospitals, and if there is an interest from the hospitals, we have been open to opening these centers and adding to this network.
That's really great. So Ramya, the whole world is struggling with COVID right now, and in India definitely we see also a large impact. Can you tell us a little bit about how COVID has impacted your project, and maybe also what you are currently doing to address those challenges with COVID, and maybe adapting the programs? Would be really interesting for everyone to hear how that is going.
Yeah, so I think with the whole onset of the COVID situation, the whole TB program took a huge backseat, and especially there has been a tremendous impact on the people seeking care in the private sector. And I think one of the key reasons for this was that in the early phase of the lockdown, I'm talking about maybe like from March to June, during those 3 months, most of the hospitals and the private sector was actually closed, and only the public centers were open and were catering to presumptives and people with TB. And even major multi-speciality hospitals was only running minimal services and emergency services. And though during these times, our TB Nanbans ensured that people who are already on treatment, were getting their drugs continuously from Chennai Corporation. And we also tried as best as possible to facilitate diagnosis, but with limited mobility and lack of transport and the general fear and stigma, there even people coming in with symptoms and seeking care dropped tremendously. But today, with the unlock of restrictions, we are finding that gradually private practitioners and the hospitals are opening up, and we do see an increase in the footfall in the number of people coming to seek care. And this has also been reflected in the number of people whom we've been able to provide care and support. But some of the challenges has been that many of the chest physicians have now shifted to teleconsultation mode of practice, and that's a little bit challenging to people because they prefer face-to-face kind of an interaction. So I think it's evolving, and we need to find ways and means of ensuring timely access to diagnosis and care for people in the private sector. And so today we are at our cases dropped considerably compared to the pre-COVID times. To the tune of maybe 10 to 20% was all the patients that we could cater to. But subsequently now it's risen to about 50 to 60%, and we are hopeful that in a month or so we will go back to our pre-COVID times, when we were able to cater to close to about 700, 800 presumptives and 300 people with TB every month.
Oh, very interesting. And do you see, because of COVID, that there are more people now that you're getting back on track, that there are actually more people coming? Because where have all those people been in the lockdown time, right?
And even now, interestingly, we are coming across more of extrapulmonary, people with TB. Yeah. And I think probably because of the similarity of symptoms like fever, cough between COVID and TB, there is still quite a bit of stigma, and there is a hesitancy on the part of the people to come and seek care. Or they actually get tested for COVID, but there is no testing for TB being done. So that's why the number of extrapulmonary patients is what is actually contributing to our pool of patients currently, especially in the last couple of months, because they had to seek care because of the difficult nature of the disease of extrapulmonary.
It's going to be so interesting to see, especially in the next few months, as you say, that you're ramping up, and to actually keep track of exactly what you're talking about. Extrapulmonary cases are just completely different. So we will see a very different field of our TB patients, and that's going to be really important. Thank you, Ramya. This has been really, really fantastic to hear your insights. And if you could give the TBPPM community, anyone who would be interested in engaging the private sector like you do and starting some centers like you do, what kind of advice would you give someone who says, I would want to do that in my area too?
Yeah, I think one of the first advice I would like to give is it's important to involve the different players in a private health sector, not just restrict to one group of private health sector people, like private practitioners alone or private hospitals. We have to reach out to each and every one of them, including a pharmacist, including a private laboratory. So, and we need to create this linkages between the different players in each area, because once we establish that linkage, and many times it's already there, there are already linkages between labs and private practitioners. So I think we also need to capitalize on it and get them engaged in the program. Second is, I think if we were to truly have a meaningful private sector engagement, it is important to ensure quality of care for the people receiving treatment with the private sector. And for that, it's important that if we have a cadre of people like health workers, delivering the care and support, they need to be involved right from the start of the journey, which means right from when a person comes with symptoms of TB to the private health sector, so that we help them and facilitate them to successfully complete the journey without dropping out at any time point. And I think it's also important to look at holistic care and support, and go beyond just notification, beyond DBT, and provide comprehensive social support to both the person with TB and his or her family, because that is something especially it is quite lacking in the private sector, because he or she is only looked as an individual patient, and unlike a public health program. So that comprehensive care and support is very, very important even in private health sector. And I think last is, we also need to understand that any program that we do engaging with the private sector, the intervention and modalities, one size will not fit all. So we may need different types of interventions to engage the private sector comprehensively. So the model that I sort of explained could be one, but there could be people who prefer to only take treatment with the doctor without getting referred elsewhere, or they wouldn't want a supporter coming in. So I think then we need to find innovative ways of reaching out to this group also. I mean, these are some of the advice that I would give for PPM.
You are a wealth of information and some really important lessons here. And I think the details that you have to share is fantastic, and I really hope that our community, anyone who's listening in and interested in the TB Free Chennai initiative, please know that Ramya is happy to answer any questions and support you if you are going to be looking at starting something similar in your area, and we will happily facilitate and look into the different lessons that the Chennai initiative has to share. Ramya, thank you. This has been such a great conversation. Really appreciate your time, and we will be talking to you soon again.
Yeah, thank you, Petra, and I'm happy to reach out to other members in this community, and we'll be happy to share our experiences, and I'm sure together, along with the private sector, we can make a huge dent in the TB program and really make a difference in the lives of people with TB. Thank you.
Thank you so much. Have a good day, everyone. Goodbye.